Hello, my name is Victoria Ledkins and I'm a student nurse at the University of South Alabama, and today I'm going to be doing my medication administration checkoff. Here's my badge, and I'm going to do a room scan. I'm going to grab my iPad to do a room scan. Sorry, I'm working with limited space, but here's my resources. Just all my supplies I need. Now I'm going to start my video. Okay, so I'm going to start by saying that this is a no interruption zone, which means that I am not going to answer any phone calls. The door is going to be closed. I'm going to let my colleagues know that I am drawing up medication, so I cannot talk to them. And also, I'm going to not talk to anybody unless it's an absolute emergency. So I'm going to start by comparing my patient order form and my MAR. I'm going to start by comparing patient's name. Jaguar J. Jones, Jaguar J. Jones. Date of birth 8/25/1963. Date of birth 8/25/1963. Medical record number 4176352. Medical record number 4176352. Allergies to penicillin. Allergies to penicillin. Today I'm giving morphine sulfate 5 milligrams. Morphine sulfate 5 milligrams. Intramuscular every 4 hours. Intramuscular every 4 hours. PRN for pain. PRN for pain, which means as needed. So the right indication for this medication would be pain, and for documentation, I would just document anything I needed to up until this point. Now I'm going to put my patient care order form away, and I'm going to take my MAR into the medication room. I'm going to perform hand hygiene. And I'm going to begin my first check of the 7 rights. So I'm doing the medication for Jaguar J. Jones. Today, Mr. Jones needs morphine sulfate, so I'm going to get morphine sulfate. I'm also checking the expiration date. The expiration date for this is 12/20/2025. So it is good. So it is, I need 5 milligrams. This is a 10 milligram per milliliter bottle, which means I need 0.5 milliliters. This is an intramuscular injection, so I need a 3 milliliter syringe. A blunt tip cannula. And a 23 gauge needle. I'm going to put all the other vials and supplies to the side since I will not be needing those. Now I'm going to begin back to my first check of 7 rights. So I did morphine sulfate, 5 milligrams, intramuscular, every 4 hours, PRN for pain. This is Mr. Jaguar Jones, and the right indication for this medication would be for pain, and I would document anything I needed to up until this point. Now I'm going to clean my vial. While cleaning my vial, I will clean from the inner circle to the outer. Throwing that away. Now I will get my 3 milliliter syringe. And I'm going to start with my blunt tip cannula. And I'm going to screw it on there. Now, before drawing up the medication, I'm going to draw back 0.5 milliliters of air. So now I'm going to take the top off the blunt tip cannula and I'm going to inject the air into the vial. Flip the vial around and I'm going to draw up 0.5 milliliters of morphine sulfate. I'm going to draw a little bit more just so to get the air bubbles out, and then what I don't use I will put back in. Now I'm going to get the top of the blunt tip cannula. Well, I say I am. And I can scoop this one up because it has not been in a patient yet, and so it is okay to do that. I have to put my needle on. There is my 0.5. Now I'm going to take off the top of the blunt tip cannula, and I'm going to put on my 23 gauge needle. Now I would get another nurse to check me and make sure that I have had my 7 rights. They were correct. I would check to make sure that they agreed with my calculations and that I drew up the right amount of pain medication. I'm going to set this here and I'm going to perform my second check of rights. I'm starting by saying the patient's name, Jaguar J. Jones. I'm taking my vial and I'm going to compare it to my MAR for my second check of rights. Morphine sulfate, 5 milligrams. This is a 10 milligram per milliliter bottle, so I'm going to do 0.5 milliliters. Every 4 hours, PRN, so PRN means as needed, and it has been 4 hours and Mr. Jones is asking for his pain medication. This is an IM injection, which is intramuscular, which is why I have a 23 gauge needle, and it is a pain medication. The right indication for this medication would be for pain, and the right documentation, I would document anything up until this point. As I said again, I would get another nurse to check over me just to make sure I did everything correctly. Now I'm going to make my label for my syringe. I'm going to put patient's name, Jaguar J. Jones. The medication is morphine sulfate. The dose is 5 milligrams, which in this case is 0.5 milliliters. The right route is intramuscular. The right time is every 4 hours. PRN, which is as needed, and it is a pain medication is the indication, and that's what I will put on it. Now I'm going to put my label on my syringe, making sure to put it at the bottom of my syringe so I don't cover up how much medication I have drawn. I'm going to get another nurse to check and make sure that this is correct. Now I will be taking my MAR, my vial, and my syringe and needle with my label to my patient's room. I'm going to perform hand hygiene. I'm going to introduce myself to the patient. Hello, Mr. Jones. My name is Victoria, and I'm here to give you your morphine sulfate, your pain medication. I'm going to explain the procedure to the patient. I'm going to raise the bed to a working comfortable height. I'm going to lower and raise any side rails that need to be lowered or raised. And now I'm going to begin my third check of my 7 rights. I'm using my MAR. my patient armbands, and also my vial and my syringe with my label. I'm going to start off by doing patient name, Jaguar J. Jones, Jaguar J. Jones, Jaguar J. Jones. I'm going to use two patient identifiers, date of birth 8/25/1963, date of birth 8/25/1963. Medical record number 4176352, 4176352. I'm going to check for any allergies. I see he has an allergy to penicillin. I also would ask Mr. Jones if he had any other allergies that he was aware of that may have been missed. Now I would start a pre-assessment. I'm going to check the patient's blood pressure, heart rate. I would also assess his pain scale, and then I would go back to finishing my 7 rights. Now I'm going to check the right medication, morphine sulfate, and morphine sulfate. 5 milligrams. This is a 10 milligram per milliliter bottle, so I would give 0.5 milliliters, 5 milligrams or 0.5 milliliters. This is an intramuscular injection. Every 4 hours PRN, and it has been 4 hours, and Mr. Jones is asking for his medication. The right indication for this medicine is it is a pain medication, and I would document anything I needed to up until this point. Now I'm going to put on my gloves. I'm going to put on my goggles. And I'm going to start by cleaning my injection site. Now, since this is an intramuscular injection, the most preferred site for this medication is the ventrogluteal, and I can find it at I would put the heel of my palm on the greater trochanter, which is on your thigh, and I would point my thumb towards the groin area, my pointer finger towards the anterior and superior iliac spine, and my middle finger would go towards the iliac crest. I'm cleaning the injection site from inner to outer, and I'm leaving my alcohol pad on there just to give me an indication of where to give the medication. Now I'm going to get my medication. I'm going to take the top off, put it in the sharps container. Since this is an intramuscular injection, I'm going to spread the skin and give the medication at a 90-degree angle. I'm aspirating for blood. I'm going to inject it slowly. I'm going to put my needle directly into the sharps container, and I'm going to put my alcohol pad over the injection site for a second, not putting any pressure, and now I'm going to throw it away. I would begin by assessing Mr. Jones, making sure I did not see any signs for an allergic reaction. I would make sure he was okay and was tolerating the pain medicine. Now I would lower the bed back down. I would raise the side rails and lower side rails that needed to be raised and lowered. I would also, I would take my gloves off, and I would take my goggles off. And according to hospital policy, I would either go back in about 30 minutes to an hour and reassess Mr. Jones. I would reassess his pain scale to see if the medication was working. And now I'm going to wash my hands before leaving his room. Now I will go back to the nurse's station, and I will document how I administered the medication, the route I did. I would document the patient, who it was. I would say how I drawn up the medication, the calculations. I would go back and document everything. And that completes my medication administration checkoff. Thank you.